Hi, Dr. Shaikh. Very nice to meet you, and thank you so much for staying up so late there for us. I appreciate it.
Hi, Vassy. Good evening to you too.
Can you give us a sense of what it is like right now where you are? We're reading so many headlines about how dire the situation is in Ontario, or rather in India with COVID. What is it like?
Right now, we are facing a very unprecedented situation, something that we had not prepared for, something that we had not seen in 2020. So the figures right now, every day we are getting new cases to the tune of more than 300,000 cases in India. And even in the city of Delhi, the number of cases are going up to 25,000 per day, even with decreased testing. So you can understand that the numbers that we are seeing are almost three times than what we were usually seeing in the year 2020. And actually, our infrastructure was not ready to handle this many numbers, and that's led to more suffering and more deaths and more chaos all around.
And I've also read that there is sort of a thought that even those numbers are perhaps underreported. Do you think that's the case?
Absolutely, absolutely, because a lot of people are not able to access the RT-PCR test for the diagnosis of COVID, either because they're long queues or they usually have the typical symptoms, so they do not want to get the test done just for confirmation's sake. So these numbers would probably at least 40 to 50% less than the actual figures. The actual figure would be somewhere around 500,000 cases, happening every day, new cases in India.
And when you speak about the healthcare system being overloaded, can you describe for us what that means?
Just to give an example, if the number of beds which are available, or the number of ICU beds available, or the number of oxygen supplies and cylinders and oxygen beds available is quite disproportionately low as compared to the demand. So a lot of people are in the queue, for one bed to get empty, either by the death or the discharge of a patient for them to occupy that bed. And a lot of people who actually needed hospitalization are right now at their homes, and there are home-based ICUs being set up, the home oxygen facilities being set up, just because we don't have enough spaces in our hospitals.
What about the equipment that's needed for those beds, for example? Is that something that is available there, or do you need other countries to be sending stuff?
Absolutely, because right now we are in a great need of getting ICUs and ventilators and oxygen transport and storage equipments. And this is not something, that can be manufactured overnight in a country, howsoever developed they may be. And that's why we are depending upon the aid from the neighboring and other countries for providing us this. Because especially when it comes to setting up an ICU or, getting a ventilator, that's not something that can be done overnight. So yeah, I mean, the internal, external, all kinds of aids are actually required during this disaster situation.
There are a number of countries right now contemplating exactly what type of aid they end up sending India. Where do you think the needs are greatest?
I think a lot of countries are mistakenly sending us too much of remdesivir, which is an experimental medicine and not really proven to be too much effective in terms of treatment of COVID. What we need right now are more of oxygen storage and transportation equipments. What we need more right now are ventilators, ICU equipments, and if possible, please also send us the healthcare workforce, because the current healthcare workforce, a lot of them are affected by COVID themselves, are exhausted, or are not really even mentally prepared to take up this challenging role once again, because a lot of them had a bad experience last time. So we are also in dire need of these healthcare workers, but we really don't know how, our current system will be ready to accept them or not. But this is the ground reality that we are facing.
And from your perspective, what is necessary for things to go in a better direction? And by that I mean, is it additional restrictions? Is it more vaccines? Is it a different rollout of the vaccines? What is it from your perspective?
I think the first and foremost thing is for the government to accept that they have made mistakes and that they are facing a problem. Because right now, even currently, the government is in denial that we never had an oxygen shortage, though people have died of oxygen shortages in the hospitals. The first and foremost thing is to stop denying and then to accept that, yes, we messed up and that we need to correct it, because until unless that's done, you can't really do anything about it. And yeah, we are in a soup when it comes to the vaccine supplies right now, because we from 1st of May we are launching the vaccines for all the adults 18 plus. but we do not have enough supplies available. As a result of which the vaccine rollout is definitely going to be dampened.
And
So we
so,
also needed supplies of vaccines to come up from the other countries.
I'm sorry, pardon me. I'm sorry, I interrupted you. What was the last thing you said?
So right now, the only vaccines which are approved in India are and which we are using are the Covishield and Covaxin. But we also need other vaccines like Sputnik, Pfizer, Moderna, to come to India so that the supplies increase.
And so when you look ahead, I mean, is there, based on what you've just said about where the need still exists and the lack of vaccine supply, are you worried about this situation persisting or even getting worse in the future rather than getting better?
Since vaccine manufacturing and supply is a very complicated process and not something again which can be increased overnight, so we don't really think that this problem will be solved in the coming weeks, and therefore India will have to wait for a very long time for its population to be adequately vaccinated to develop some kind of herd immunity. And until unless we get a lot of other vaccines, the vaccines which have been approved elsewhere to come into India, like Sputnik, like Pfizer, and the Moderna vaccine, I don't really see much hope in how our vaccine program is going to get accelerated.
Okay, I'm out of time, Doctor. I'll leave it there. We certainly are thinking of you and everyone in India, and we wish you the best. Thank you very much.
Thanks, Vash.